Good evening, sir.
Dr. Naveen, good evening. How are you?
I am good, sir. How are you?
Fine, ma'am.
Sir, we'll get to know something what they actually know. Then
Neat.
by
Okay.
session, Mari will take a CTRI registration so that they'll get exposed how to register in CTRI. Madam, sir.
How to frame research question, how to write the methodology, how to go for
Ask them first, sir. Then we'll
uh,
plan every week. So we'll plan one topic and then we'll go ahead.
how to select the resources, how
Sir.
to retrieve the resources, which is the authenticated website.
Yes.
What is Scopus, what is PubMed, like that.
So that we'll plan like every week. So we'll plan the topic today. Yes.
Okay, right. So we'll start the session. So on behalf of Department of General Medicine, I extend my warm welcome to Dr. Naveen, who is my pet student, who is close to my heart, and who is in a very renowned position, the research scholar in a supreme institution of our nation. He is a clinical pharmacologist. So I take immense pleasure in welcoming Dr. Naveen to this fourth session of our interdisciplinary forum. So actually, interdisciplinary forum is for discussing a case, but last week I thought that our postgraduates are not that much sound in framing research question, in doing, in writing in planning the methodology, in conducting the research, and overall, if you want to conduct the research, first thing is to form a research question. So how to frame a research question? You have to go into the deep into the literature. That is very important thing. Going deep into the literature is not an easy thing, because if you open the literature, if you open the internet, there are a lot of resources. You do not know which is authenticated, which is unauthenticated, which to believe, which not to believe. So those are all the confusing strategies nowadays. And then methodologies. In planning the methodology, there are a lot of diverse methodologies are there in doing research. We do not know which methodology is suitable for qualitative research, which is suitable for quantitative research. So there are a lot of gaps between planning and execution. And before that, reading the literature and planning. So a lot of gaps. So I wanted to address these gaps. So that is I invited our research scholar, Dr. Naveen. So he will be casually interacting with all PGs. So my request to all the PGs, please note, definitely we are not that much sound in framing research question, in selecting the topic, and in getting approval from ethics committee, and in planning methodology. So there are a lot of lacunae in conducting the research. You all know that. Even if you conduct the research, writing the master chart and writing the scientific writing itself is a big story. So a lot of lacunae in conducting the research. So all these lacunae will be addressed. So please come out with your doubt. Please come out with the question to the scholar. So then only it will be useful. Definitely it is not a PowerPoint session. So I have frequently interacted with the Dr. Naveen, and it will not be a routine PowerPoint session. So if you conduct the PowerPoint session, then it will be at another session. That's all. Right. So I have taken lot of research methodology sessions for my PGs in the past, but all are in vain only. So those are all fruitless sessions, because they are not interacting with me. That is the thing. So I want you to interact with my PGs, and my request again and again, my request to PGs, please interact with the faculty. Please raise question then and there. Yes, definitely you will have a lot of questions. So whoever attending, please raise question, then only it will be proved. So once again, I welcome Dr. Naveen. So
Thank
over
you,
to
sir.
Dr. Naveen, and over to the faculty for conducting the session.
Thank you, sir. Thank you for the invite. So, feel free to start actually, where you have facing the problem, like starting from hypothesis and starting your protocol, thesis protocol, and after your approval from ethics committee, conduct of clinical trial or whatever research you are going to do. So, please let me know, what are the major issues you are facing throughout your thesis actually. I know you have your postings and it will be very time consuming, And yeah, please go ahead. Yeah, feel free, and based upon this any issue, we'll subsequent sessions we'll take one session so that it'll be easy for you, so that we can go ahead actually.
Good evening, sir.
Hi, good evening.
Sir, this is Jasper. I'm a second year postgraduate.
Yeah.
Sir, my question is, in a basic sense, how do we actually, we are framing a research question, right, sir? So, how do we make sure that our research question is valid in the first sense? How do you make it in such a way that it is foolproof? Because there is certainly a lot of guidelines that we follow to make sure that our research question is submitted in a proper fashion. Is there any guidelines, sir? And if so, how do we actually work around it, sir? Because we don't have
So
any
actually,
ideas.
prior going to a research question, you need to know what is the lacuna. Like in your Thoothukudi, if you take which disease is prevalent or which type of study you are going to do first. And second thing is we need to find the gap. What is actually the gap you need, and if at all you are going to do a research in that specific topic, it should be feasible to for the treatment, like in the day-to-day basis. Just for publication, don't take a research topic. Second thing is, it is financially adequate. You can do with your normal routine lab investigation and with the drugs which are provided from our government. So we have financial constraint is the second major issue will be there during your thesis actually. First of all, whenever you're taking a topic, you need to, like, we have PubMed, Scopus, Embase, it's there. But Scopus is a little paid one. PubMed is a open base, medical base, so where you can check the articles. Okay. So first of all, do you guys have any TN medical college thesis portal so that you can check what are the topics have been taken up, and because our PG thesis most from our state not getting published actually, and it will be in our portal, in our Tamil Nadu portal. So we call it as gray literature, which is not published. And without knowing that, we keep on doing the same topic and we submit it either we had one or two objectives front or back and we publish it. That is of no use actually. So whenever you are taking any research topic, it should be you have to make it as a topic that is useful in your day-to-day practice. Okay, so just for namesake, please don't take a research topic. And you can, if you like any areas, like take it as abhi burning topic is MASLD, metabolic associated liver disease. You have none. That's non-alcoholic fatty liver disease. Into MASLD it is there. So we have many cases in South also. So you can go to any of our faculty who's if you take Rajavil sir is interested in infectious disease and antimicrobial resistance also. Now it's a prior it was a silent pandemic. Now it's actually a pandemic. So you can try infectious disease topic so that if you data whatever we are generating from our state, it can be going into a guidelines and it can change our prescribing patterns in our clinical practice. Okay, you got it. So that's what you have to, first of all, you have to see to it, is it feasible, financially adequate, and you can check with the faculty who is very much interested in that field of area, his area of interest. Then you have there is no such for thesis and all, there is no such guidelines is there. You have to see based upon this, and what is your time frame actually, when you have to submit your protocol, then your thesis submission, what is your time frame?
Sir, 12 months, sir. 6
So
months to
at
2
the end of your
years.
first year, you have to submit your thesis protocol.
Yes, sir. By the end of first year, we had to be ready with the protocol, and by second year, we do all the data sampling, and by final year, we'll have to compile it. And
6 years prior to your exam, you have to submit your thesis, right?
yes, sir. Yes, sir.
Okay. So within the first year, first 3 or 4 months, you can explore in your hospital. Like, right now you are in second year. So we'll take what is your thesis topic actually?
Sir, my thesis topic is prevalence of cardiac autonomic neuropathy in type 2 diabetes patients.
So what is
In
your aim?
Sir, my aim is to initially, my primary objective is to find the prevalence of cardiac autonomic neuropathy, and my secondary objectives are to stratify the risk of patient developing cardiac diseases, or to stratify the levels of HbA1c, the levels of urine albumin creatinine ratio, the levels
Okay.
of all those with the degree of cardiac autonomic
So you
neuropathy,
are
sir.
doing an observational study. So no, you're
Yes,
not
sir.
no intervention, only observational.
Yes, sir.
Okay. So are you finding any difficulty actually? You have start prior. So who's your guide actually here?
Sir, my unit chief is my guide, sir.
Okay. So you are you comfortable? You are getting patients.
Yes, sir. We are getting a lot of patients, but there is some lacunae with the data collection, sir.
What is the lacune actually? That is why I want to ask actually.
Sir, so right now for cardiac autonomic neuropathy, we are doing this battery of tests called as a Ewing's test. So
Mm-hmm.
Ewing's test is a set of we have a set of tests, sir. So we assess both the parasympathetic and the sympathetic. Uh, we have to assess parasympathetic and sympathetic functions.
Okay.
So we the I think the test which I do, which I have did now, is not standardized, sir.
Okay.
There is, I think the equipment we still don't. There is a dedicated machine for it. So I think if it, yeah, I think it will be better standardized if we have those.
Okay. So we don't
But
have it in our college.
uh, no, so we are yet to have it. So we can do it manually, but I feel the
Error will be there and
standardization
it is not
error will be there.
validated. Yeah.
Yes, sir. So that is being a big because we can do it clinically, but it's not as standardized as what I feel,
This is
sir.
also a major roadblock for you actually. Whenever you plan a thesis, you need to know like patient population. That is what PICOT. For any trial, or you are doing observation study for a research trial, you can have PICOT. We'll call it as PICOT: population, intervention, comparison, outcome, and time. So for your study, whenever you are starting at thesis, you need to know what are the tests you are going to do. Is it available in our college or not? And if at all we need to buy any kits outside, if you are going to test any biomarker, will be getting kits from outside. For that, you get any intramural fund from our college? Like, do you get funds?
For my study, fund is not required, sir, because it's a bedside clinical test.
Okay.
It's not
Okay.
required, sir.
Okay. We have some agencies which provide grants for thesis also, that I'll come in subsequent. So here in your case we can't do anything actually, but for others, for your freshers, they can plan it ahead actually. You need to assess first. You are getting well versed with your area, so Thoothukudi, then within 1 or 3 months you need to know what your at what month you prepared your thesis protocol actually, with first year. Like it took 6 months or 7 months.
Sir, by 6 months, our protocol was submitted to ethics committee, sir.
Okay, and how long they are taking for the approval?
Sir, 1 month, sir.
Okay. So for first year, so prior you plan it, see to it what are the availability of the resources. Then if you need any financial requirement, we have ICMR thesis grant is there. So it opens every 2 times every year. So you keep checking the portal so that prior that you need to submit the ethics committee approval and your protocol and other details. They will be providing you around 50,000. First, they will release 20,000. Then after publication, they will release you 30,000. So they are providing ICMR fund for most in India for PG thesis actually. Any other questions? Did I answer your questions?
Yes, sir.
Yep.
Okay.
Good evening, sir.
Hi, good evening.
Sir, myself, Napoleon, second year PG, sir.
Yeah.
Sir, my postgraduate thesis topic was evaluation of iron deficiency using conventional iron markers across stages of chronic kidney disease, a cross-sectional study, sir.
Okay.
Actually, my question is regarding with that, how to face ethical committee, means like a scientific committee, because it was asked about novelty in your study. First question, novelty. So everyone was asking whether this study is a well-known fact, but everyone asked about the novelty. But I substantiated with it's a regional study, so it will give a data about the Thoothukudi.
Yes.
So it was very difficult for me to face the scientific committee.
Because always, like whenever you are starting with a say research is actually you're bringing something out which is not available.
Yes, sir.
And
Yes,
it
sir.
should be published so that it will be helpful for our in and around actually south part of India or western, so that they will take this whatever results you are doing. They will it should be a practice changing topic. Then only it will be very easy.
Okay,
it has a relevancy. So
Okay,
you are telling like is it done in North India or Western Eastern India? So it is first time you are doing in Southern India. That's what you are telling, right?
Yes, sir.
Ah.
And just now I came to know that from you, sir, that ICMR supporting funds for our study.
Yeah, because we really have no idea actually. That is why I told sir I'll have a session. Then I'll go for the classes. So they provide 50,000.
Okay, so in this
So
study
you
also I'm
have
doing
to.
iron profile.
Okay.
Which is not available in our institution, sir.
Okay. So how we are going to check it? Like iron panel, we will be sending blood samples only, and
yes, sir. I have to take that economic burden on myself, sir. So you can get us.
So per patient, it will cost like prior intervention and post intervention. You are going to see, right?
Just profiling, sir.
Just profiling one time.
Yes, sir.
So per sample, per patient, how much it is costing actually?
It's almost 400 to 500, sir. My sample size was around 121.
Oh my God. Then your 2-3 months stipend will go in this actually.
Yes, sir.
And wherever you are giving the sample also, you have to store it properly, and you have to send the sample, and you have to check whether that lab is validated, any NABL accredited, everything you should see.
Okay.
And
Okay,
yeah.
Then another topic, sir, which is under our honorable HOD sir guidelines, we are doing one research conclave, sir. For that, I have taken the topic incident of a study on VAP in IMCU and its clinical outcomes and morbidities.
Right.
When I go for collaborating department
Micro
approval, it was like they were suggesting that the VAP is not available. The definition is not available now, which is converted into ventilated associated event. The surveillance form was changed. So how I can substantiate that a VAP is still useful term and clinical term, where I can search for that supporting documents or studies.
IDSA guidelines, you can see IDSA.
I shown them CDC and NHSP guidelines also, sir.
Okay, NHPS. Okay, and then ECMID also it's there. I'll share it in the group. There also you can show. And are they interested in this actually? You have to find out.
They are suggesting to change the topics. Change the VAP into ventilator associated event. That includes 5 different spectrum of categories, sir. Which one among them is possible VAP.
Okay.
Positive VAP or possibility PVAP is given under that topic, sir.
Okay.
So how I can substantiate this fact?
No, in that case, like what you are going to see in VAP.
Sir, we are going to see the incidents, mainly incident and duration of the ventilation and outcomes in our college and in our IMC setups.
Let me check it actually. WAB, okay. So
And,
like one tip actually, whenever you're taking a topic and for thesis, if guide is allotted accordingly, or you have to go and approach any faculty in our Thoothukudi department, medicine department, and you have to do, or they will allot you accordingly.
both ways are possible here, sir.
In that case, you should know which area of interest you are taking. That faculty also should have it.
Sure, sir. Okay, sir.
And other collaborating department also, you need to know which faculty is interested in this area. Some might be in bacteriology, fungal, parasitology. They will be interested. If you go and ask them, they won't. They will tell. So that is also an issue actually. So collaborating department, you need to find out, and you can check their Google Scholar, their name. If they have published any studies, preferably your area of interest, you can approach them. Mostly, if their area of interest is there, pakka they will be supporting you. So you have to make this actually. Nobody tells this actually, but you have to check it out. Yeah, I'll check this. So they are telling you ventilator associated pneumonia. What they are telling? Ventilator
We have to
associated.
change, the term is absolute now. According to some hospital surveillance form, we have to use the term ventilated associated events, which includes 5
I'm also
subclassifications.
hearing for the first time actually, but let me check it actually.
Okay, so then,
I'm not aware of this.
Then my third question
Shall I
will
interrupt,
be...
Dr. Naveen?
Yeah, sir.
Dr. Napoleon,
Yes,
this,
sir.
they are always having this the IDSP, Integrated Disease Surveillance Program. Surveillance program is totally as primary healthcare entity. Okay, but we are not bothering about primary healthcare entity. We are bothered about tertiary care. Okay. So in the tertiary care, this ventilator associated event is not coined in our setup. Even Harrison says, right, all the antibiotic surveillance program says, antibiotic stewardship says, ventilator associated pneumonia only. So ventilator associated event means what else can occur apart from pneumonia? So what are the other common complications of ventilator? We have not come across. We are coming across only the pneumonia, infection only. And we are bothered about only the infection because that is causing high mortality. No other event is causing high mortality. So you have to substantiate with these points in the ethical committee or scientific advisory committee. Okay. So ventilator associated event, sir, if you say in such name, so apart from pneumonia, we have never come across any other event in ventilation. So ventilation is 100% associated with the infection only, and we do bother about the infection only because infection is causing high mortality. So that is we are seeing in routine ICU life and day-to-day activities. So in our study, so pattern of infection and pattern of organism, pattern of sensitivity, okay, and how far this antibiotics, the infection is responding to antibiotics, and what is the mortality in particular infection. So these are the goals and objectives of this study. You can talk like that. Ventilate. So our Bible is Harrison, right? Or any other guidelines. Okay. So far I have never come across this terminology in our Harrison or in any of the recent medicine conferences like that. Like that you can answer.
Okay, sir. Thank you, sir.
Like, what is your time frame for this research conclave?
Sir, 3 to 6 months, sir.
Okay. So, can I give any topic so that you can, is it feasible? You can take it actually. So you can check, like you are aware of empirical prophylactic.
Yes.
So in that case, you can check pattern of empirical antibiotic use and what is its concordance with the, we have antibiotic culture sensitivity reports. That is also you can do prospective audit and feedback.
Okay, sir.
Or else, you have any idea about aware antibiotic classification? Axis, watch, reserve, group.
Yes, I have come across that. Not
So in that case, you can say you can do as a prescription audit like that prospectively. You can check what are the proportion of antibiotic prescriptions which are adhering to the WHO aware classification. So you, in that case, you can check empirically how what is the prevalence of drugs like colistin, polymyxin B. Are you guys using
Colistin, it's not available here, sir. We have
polymyxin
linezolid.
B?
No, sir. We have linezolid only, sir.
Okay, that is also a reserve group of drug. So this is also a good topic actually, because we don't have much about research finding from South.
Okay, sir. Okay,
If you do this properly, research conclave also you can publish. We have ICID conference in Spain, which is coming in November. There also you can publish, come and present. That is a good one actually.
okay, sir.
Always think globally. Whatever topic you take, you have actual finding. Do not manipulate the reports or the findings. Whatever it is, positive or negative, you write it down. And always, whenever you are writing everything, please note down in one hard copy and one soft copy. Keep it in the Google Sheets,
Okay,
because we always we do compiling at the last. We should not do
okay,
it.
sir.
Do it on the day itself. It will be little bit irritating actually, besides your clinical work doing this. But if you do this whenever your final compilation, it will be very easy for you. And take
Okay, sir.
photos, keep it in the drive, so that if you want to come back, check, it will be easy.
Okay, sir.
Take a
Sir,
good
and
topic at AMR and please present in ICID or any international infectious disease conference will be coming in. Do present.
okay,
Or
sir.
else we have in Batinda, we have Society of Antimicrobial Stewardship Practices in India. It is coming by October. There also you can come and present your poster or oral.
Okay, sir.
Right. Ames Batinda, it's happening.
Okay, sir. Sir,
Yeah.
my last question, sir.
Yeah.
This might be a important topic today also, like the
Yeah.
usage of AI, sir. So
Usage of AI.
AI.
Okay.
So in the which could be used for which can be used for framing the data sheet or our data sheet, sir. And that's why, sir. Which tools
No,
can be used in?
actually, right now, AI tools many are using, but the publication now, whenever you are publishing your research work, some places they are clearly asking if are you using any AI tool for your thesis, for your research. You have to mention it. Some journals they are accepting it. AI should be a supportive one. I'm not against it, but you have to use, but not everything from AI. Framing a research question, conduct. Some people they put up the data, they manipulate it, they present it as their data. That you should not do it. You can take help from AI, but not fully. Supportive only.
Okay, sir.
Yeah.
Thank you, sir.
Thank you.
Sir, good evening, sir.
Hi, good evening.
Sir, Bhagavati, second year medical for
Yeah.
postgraduate, sir. Sir, like how to store a data, sir? Like digital. Is there any app or anything to
What is
store
your study?
Sir, an QT, an observation study, sir. It is an QT dispersion before and after thrombolysis in myocardial infarction patient and its prognostic implications. So I have to collect ECG of the patient like around the like at the time of hospitalization, then 90 minutes, then 3 hours, then 24 hours. Then I have to store the patient like electrolytes reports, like everything. Is there
So
any?
actually, there is one EpiCollect software is there. It is a free software.
Okay.
You can check the YouTube how to you can use it where you can frame your CRF you are making a case record form.
Yes, sir.
So here you can make it as a digital one. So everywhere we can't take our pen and paper. We are writing down everything. EpiCollect software is there. You can use it where you can enter. You have to frame the case record form, name, age, sex, and everything, and your whatever parameters you are going to check. You have to enter it. so that whenever you are getting a patient, you can enter it on time. AP Collect software.
Yes, sir. Okay, sir.
You can use that.
Okay, sir. Thank you.
Yeah.
Hello, sir.
Hi.
Good evening, sir. It's
Hi,
Bhupan,
good
first
evening.
year, first year
Yeah.
PG, sir.
Hi, good evening.
Sir, my doubt is like, sir, while doing any research trial, sir, doing it, if we usually get that informed consent, sir, like,
Yes.
we get that consent,
Yes.
but there is a stigma associated with patients, like, when we say like we are going to add a new drug, so they get some stigmas. So most of the patients just avoid that. So is it possible, like, without getting the informed consent, is it
No. That will create actually a major implication in your whenever you are going to publish or whenever
Yes,
it is getting published, right? That
yes, sir.
journal will ask your, sometimes they will ask your informed consent form also, and that informed
Okay.
consent form, which language you take.
Sir, like, no, sir, like, I'm not saying like without getting completely getting, we are not asking, sir, but rather how to convey it, or there is a problem while conveying it, sir. When we say like we are going to add a new drug, no, they first hesitate to, sir, they're feeling hesitation to, they
Yeah, I
hesitate to
understand totally.
sign
Yeah.
it. So my topic is like, comparative study between this traditional hyperkalemia correction and traditional hyperkalemia correction with K bind, sir. That is
Okay.
calcium polystyrene
Fine.
sulfonate. So when we say like you have to get a powder from outside, and
Right.
they ask why it is, what for, and all. When they ask, and now along with it we ask for a sign, means it, they feel that stigma, sir. One or two patients I asked, uh,
What is your sample size?
so it's around 60, sir, 50, 60, and
Okay.
so
See,
in CKD
informed
patient.
consent. Yeah, informed consent. You have to explain it everything in
Yes, sir.
Tamil
Yes,
only.
sir.
And
Okay, sir.
in that form also, you will be having one informed consent form and one patient information sheet.
Okay, sir.
Patient information sheet, you have to explain everything.
Okay.
In that also, you are going to tell in between the trial, if they are not willing, they can leave. So clinical
Okay.
trial, it happens.
Okay, sir.
Which patient is very well comfortable and they want to take it ahead, you have to take, because I have done a double blind RCT for drug resistant epilepsy patient, where along with their normal intervention, I gave placebo, that is glucose capsules,
Okay.
or probiotic
Okay, sir.
strains I gave. So
Yes,
my
sir.
sample size is 60, 30.
Okay, sir.
So my dropout rate among 60 were around 15
Okay, sir.
overall. And I screened around 480 patients. Out of
Okay.
that, I got 60 patients. And from 60 also, my trial timeline is around 9 months. So
Okay, sir.
some they dropped out between. So it
Doctor.
happens. So this is how we do the research. So don't worry.
Okay.
Keep on doing your screening. Always start your like you have a during your approval. After your approval, you screen the patients, right? Note down
Yes,
their
sir.
number and details, and you give your number also. Some people, there will be a change of mind. They will come back to you. So
Okay, sir.
no worries, and prior completion also, like if your sample size is 60 and you are able to complete 50 or 40, you can write for to the IEC that this much patients only got. But for you should have a data that you have screened this many patients, and out of
Okay.
this only were eligible, and they were agreeing for the trial. So you should have a proper documentation of the screening. You take printouts, screen, and then note down their demographic details, their
Okay.
number, and which date you did. If you have everything,
Okay.
then it's clear.
Okay, sir.
Okay.
Okay.
Yeah.
Thank you. Thank you, sir.
Sir, I have one more question, sir.
Yeah, Jasper.
I'm doing a second, my research conclave, my short-term studies guided by HOD sir, and my topic is to compare meropenem as a bolus dose versus meropenem as a continuous intermittent dose, yes, sir, over 3
Extended
hours.
dosing.
Yes,
Hmm.
in patients with urosepsis in our IMC setup, sir.
Right.
Yes, sir. Sir, so for my first question is, for this, how do I change my consent, sir? How do I explain uh, one group that? So is it as my
It is an open label or double blind? Open label only, right?
open label, sir? Yes, sir.
Okay.
Okay, sir. So
See,
should
in that
we?
case, you are anyway giving the drug.
Yes, sir. Yes, sir.
So only the time, in that
Yes,
case,
sir.
you don't need to explain much. You are going to tell only time.
Okay,
If at
sir.
all, in some cases, you are giving any other different drug, you can explain them. Here, only time period, no, that's not a big thing, but you just you are getting consent.
Yes, sir. We are getting a consent, but is it mandatory that we mention that that
Extended
time duration?
dosing, I don't think it really needed actually. You are
Okay,
anyway
sir.
giving both of them same drug.
Yes, sir.
One you are giving bolus, one you are giving extended dosing. No issues.
Okay, sir. Sir, my next question is, there is no set study telling about the superiority of extended dosing meropenem in South Tamil Nadu. So I've
You
taken a
said
study.
any related evidence published anywhere?
Yes, sir. There is a trial. There is a study which was published in Europe. That is
Okay.
so. That is how I based my sample size calculations on. So, is it mandatory that we should take it from that, or shall we do it as a pilot study with a fewer number of samples? And
You
how?
can really do. See, we don't have that much of. That's why I'm telling. We don't. Most of our thesis in South, not if we take 100 out of less than 10 only get published. Am I right?
Yes, sir.
We need this kind of study. Don't think about the larger one. Take a pilot one, 30 patients, do it properly, get the data, publish.
Okay, sir. Sir,
And do
my
attend conferences,
okay, sir.
infectious disease related one. There you meet people, you see other posters, oral, you'll get more idea what you can do. Next, you will be
Okay,
doing DM or SRship. So you'll be no, you will be continuously you'll be doing now. And as of now, research is actually really needed. Prior,
yes,
it was like a taboo. We won't do research, but now we need to do it actually.
yes, sir. Sir, my last question is, we are actually we chose to study so that we could actually publish it in a journal.
Yes.
Because just because it's a pilot study, does it make the power of the study inferior?
If it is a
Is
novel one, no, don't think like that. Do the study, and this will change our practice in our area.
okay, sir.
So guidelines, ICMR will see the study if it published in a good journal and you have good results. And whatever it is, if it is a positive or negative, please publish.
Okay, sir. Okay.
So negative results came, so you don't get disheartened that we need it. Whatever it is, we have to publish it, positive or negative.
Thank you, sir. Sir,
Okay.
how do I have not published any study of mine, be it in my UG or now. Sir. So, if I take
Okay.
it forward and finish my study, uh, how do I publish it in a way in my
So
next?
prior you publish your thesis, start with a little bit of case report. If you find any rare case or anything, start with a case report. Then little bit within now you are in second year, you have 2 years. If at all you get similar case series, start with it. Show it your guide, HOD sir. Then they will guide you how to write it, or you read papers in PubMed. You will have an idea. And if you need to do statistics, please go to our SPM or biostatistician if we have, do proper statistics and then submit it. For case report, case series, we don't need statistics. Start with small. And for observation studies and all, descriptive statistics only you need. Mean, median, mode, proportion. That you can do tabular column, and then start with small studies. And if you are in India, I am associated with the one journal for antimicrobial stewardship practices in India, JASP. If at all, if you guys want, you can go through it. There you will get to know how to like how is it letter to editor, review article. But you don't have time for review article. Better go with case report, case series, then observation study. Then if you have so much time, then you can go for clinical trial.
Thank you, sir.
Sir, we have a topic on next month, sir. We are presenting posters in that.
Which one?
What makes a topic on, sir?
Okay, then what topic you are doing?
Poster case report. I'm going to present a case report in poster, sir.
Okay.
What points makes the poster more attractive?
See,
how
poster less words, more pictures.
Okay, sir.
So you don't need to put too much of words in it. Introduction, 2 lines. Methodology, 4-5 bullets. Result, 4-5. Conclusion. Then one pie chart or whatever table. Then one more a table or figure. At the bottom, 1 or 2 reference where you saw similar work anywhere. Don't put too much of words. Keep it very simple. More 1 or 2 figure is more enough, and less words.
Okay, sir. Thank you, sir.
So you call it as IMRAD: introduction, methodology, results, and discussion.
Okay.
So analysis that you can write in methodology itself. That's not an issue. Very keep it very like what do you say? Not congested words, less words, 2 diagrams. That's it.
Okay, sir. Thank you, sir.
Other PGs, any doubts regarding your research proposal or conducting study, second years, first years?
Good evening, sir.
Hi, good evening.
This is Mohan. This is Mohan, second year postgraduate, sir.
Hi.
My doubt is regarding the inclusion and exclusion criteria, sir.
Okay.
Whether it is based on the previous study or whether it is based on the researchers, sir.
No. Yeah, completed. Yeah.
My study topic is on medication adherence in patients with type 2 diabetes mellitus and its correlation with glycemic control.
Okay.
If inclusion criteria, diabetic patients, if we have to take more than 40 years of age,
okay,
is my inclusion criteria. Whether we can place it based on previous studies or our own, sir.
See, usually we like you are telling till 40 years.
No, sir, above 40 years, sir.
Above 40. So like adults 18 to 60 we can take. That is our time frame, like age extremities 18 to 60. So based upon your population, what you're seeing, you can change.
Okay.
Because
Okay, sir.
earlier studies, if they have taken less than 40 and you have more than 40, you are generating a new evidence. It's up to you.
Yes, sir.
But the age extremities are 18 to 60.
Okay,
So,
sir.
yeah.
Thank you, sir.
Yeah, feel free, ask. Don't think you're asking any silly mistake or silly doubt. Everything is useful for you in future. So please ask.
Good evening, Dr. Naveen. I am Dr. Arun Kumar, Registrar of the department. Sorry, I was late to the meeting.
Good evening. Yeah, sir.
I offer my regrets that I couldn't switch on my video because I am speaking from my clinic. My net is slow.
Yeah,
so I
sir.
have 2 questions for you.
Yes,
for the
sir.
sake of postgraduates.
Yes,
From
sir.
your experience, what kind
Yes.
of studies are accepted in ICMR, whether they are preventive aspects or curative aspects for funding?
Sir, like interventional trials, studies, they are accepted more, and observation studies, not much, sir.
Okay.
Interventional trials are accepted more, actually.
Mm. So
And
whenever these
if at
go
all
on.
any translational research, like any new biomarker which they are doing and which can change the practice, that kind of studies also being accepted, and novel studies also they are accepting, actually.
Okay, okay.
Yes, sir.
And when you see you have been here in state university as well as central universities, I hope so.
Yes, sir.
So what kind of difference in mentality to research do you see peculiarly to central institutes compared to state institutes like
Sir,
us?
actually, I did my MBBS from 2009 to 15. Then I came to PGI in 2017 until date. So 10 years. So research spectrum in state colleges are increasing now. It's in an increasing trend comparatively to 10 years prior.
Okay.
And most of the research work are not getting published. That is the sad thing, actually.
Mm, mm.
And we don't have data from south. That is why I was discussing with HOD sir that people are doing, but it's not coming published. Without published data, research is nothing, actually. We need to know, it should be in the forum, and that is why like it will change our practice, treatment guidelines, and everything.
Okay, okay.
Yes, sir.
So that is one sad aspect which still persists because we don't do much documentation when treating.
Many
So that's
manipulation
why.
also happening, sir, actually.
So we don't even do documentation, then only can manipulate.
Yeah, that
We
is
don't
what I
need
was
the
telling
data.
him, actually. Yeah.
Okay.
Yes,
And
sir.
other thing is that that's why our sir has started this research conclave
Yes, sir.
to make things getting documented. Now, my
Yes.
another question is about intervention studies. So most of the intervention studies, as you say, it is based on any drugs or any novel interventions.
Yes, sir.
Any research is going on non-pharmacological interventions in patients,
Yes, sir.
like
Yoga.
yeah,
Yoga.
please go on.
Yoga, sir. Yoga. It's going on.
Yoga. That is one part. But
Yeah.
even in our intensive medical care setup, I read about on a study where the patient's hands are warmed with gloves so that their kind of recovery is faster in those patients. So
Okay.
how about these kind of non-pharmacological interventions? Usually interventions we think about any drug or some other things.
Yeah.
So in non-pharmacological interventions, whether those kind of studies are going in the north or
Sir, actually, some places like in PJ, we have an exclusive yoga department. So they are doing in patients prior to surgery, their anxiety, palpitation reduction, that kind of
okay.
work, and some hypertension also they are doing, and depression, psychiatric plus yoga they are doing, actually, and they are generating evidence, non-pharmacological management. They are doing it, actually. Some thesis also they are doing for MD, yeah, MD and DM also they are doing thesis as yoga as intervention.
Okay. Okay.
Yes, sir.
To answer the first query raised by our registrar, that is which are the projects commonly approved by ICMR. So I have been guide for many of the STS topics. There is a short-term studentship of ICMR.
Okay.
So it will be usually it will be selected by pre-final students. So usually ICMR will select the topics which are having public impact, social impact, topic which are having relationship to public health problem. For example, I'll say one important topic, that is a prevalence of hypertension in salt pan workers. It was immediately approved because salt pan is a very common profession in coastal areas, and the workers are suffering from hypertension. So this study was approved immediately. Another one example was and prevalence of hypertension among night duty workers in healthcare professional. Those are all doing frequent night duties, and it was approved immediately without any second thought. So one another example I want to cite is impact of social media in learning of pre-final or final MBBS students. So this was also immediately approved. So these types of studies which are having relationship to social issue or public health problem or public health or social connectivity. So these will be approved immediately by ICMR. So actually I wanted to encourage the students because ICMR is infusing lot and lot of funds.
Yes, sir.
Even for STS, they give 25 to 30,000 for a pre-final student. So I have somehow I have motivated 3 of my pre-final students to select topics 2 to 3 years back. But the piteous thing is, the last 2 years I was not able to motivate a single student for STS. So that's a problem. So at least if we motivate the postgraduate students, then they will motivate the undergraduate students. So then the research problem, it will be a chain of events. So that is my idea.
Exactly,
In
sir.
this case, ICMR MDMS research grant, first they will release 20,000, and after publication of your thesis only, they will release 30,000. So total 50,000.
Okay.
So areas mostly infectious disease, and sir, as a public health, drug safety, medicine. So these are the main areas actually. You can check out in ICMR MDMS thesis grant.
One more question, Dr. Naveen.
Yes,
So
sir.
what about the collaborative studies between different institutes? So why do we not go for collaborative studies?
We can do, sir. I told Sir Rajvel, sir, like I'll be posted in Delhi. I'm waiting for the order. Once I go there, I'm planning to do a multicentric trial or observation study, because we have done a antimicrobial prescription pattern in tertiary care centers. It is a point prevalence survey. So it is a one time. We'll be checking out the whole hospital. What is the prevalence of drugs prescribed according to our classification and hospital acquired infection prevalence? We did actually. We published this data in Lancet. So we did around 8 central institute. We did one government medical college in Bhopal. So we can do it actually. For that, we need to have ethical clearance from each institute and from the main coordinating institute.
Thank you, Dr. Naveen.
Yes, sir. Thank
So
you.
any other PGs who have doubts, you can clear it, sir.
The June 1st, you are having a SAC committee meeting. So in SAC, you will be bombarded by so many questions by the ethical committee members or SAC committee members. So I want my unit, my department pages to stand proud and students to stand alone and stand aloud in the ethics committee and SAC committee. That is why we are taking a lot of pain in arranging these types of meeting with the experts. So if any doubt, you can clear it so that you can boldly face the questions by the ethical committee members or SAC committee members.
Make mistake and you will learn seriously. Don't hesitate. Our faculties are very approachable, and sir only gave me first antibiotic book, and it all changed my life actually. I went into pharmacology, then clinical pharmacology, and it has been 10 years in this field. So that's what.
Good evening, sir.
Hi, good evening.
I'm Madhivadana, first year PG, sir.
Yeah. Hi.
Sir, how to select a study design for a research question, sir? Which study design is how to select study design, like which type of study, prospective cohort or
See, it's all based upon your patient population and your inflow. What is there? If you are, it should be feasible also. You can do retrospective according to your hospital files, but you have to see, is it valid and is it properly they have entered the data. Otherwise, whichever disease you are checking
okay, sir.
first, that is what same pick out only: population, intervention, comparison, outcome, and time.
Okay, sir.
So have you decided your thesis topic?
Yes, sir.
Yeah, tell me.
Study to correlate atherogenic indices to metabolic syndrome in new onset diabetes
Okay.
patients.
and you can go to our hospital uh, administration. There we have record, na. You can go through if you have data.
Okay,
You
sir.
can do bi-directional. So retrospectively, you can do a short pilot. You can check prior approval of your thesis. Then you can go ahead with your prospective also. But usually, if you have a good number of patient inflow, what you are going to see, actually, you are going to see only the prevalence, or you are going to check any blood parameters or anything.
Yes, sir. But lipid profile,
Only.
blood parameters also.
So it is an observation study.
Yes, sir.
Better go for a prospective. That's what. Main thing is you need to check patient population, how it's in your area, that you need to check.
Okay, sir. Okay,
Okay.
sir.
Yeah.
Okay, sir. Thank you, sir.
And have you guys did your BCBR course? Do you are aware of your BCBR NMC course? You have to clear it prior your PG
Yes, it
exam.
is mandatory. It is
It is
mandatory for
mandatory now.
them.
Have you gone through?
No, sir. No, sir.
No idea, right? Please go. I will share the link in the group. Please go through it. Log in. So there are 23 assignments are there. Slowly go read it. There will be video. Then there will be MCQ. Finish it off. Then after 23 assignment completion, there will be an exam. You have to go and give in center. 1,000 rupees only. Finish it off. Get a certificate. But this is not. It is mandatory for your PG. But second thing is, you will learn about the basic things in research and publication.
Okay, sir.
Okay, please do it in your first year itself. Don't prolong it to second year, third year. You will be very much held up with your thesis.
Okay, sir.
Right? Yeah.
Thank you, sir.
Thank you.
Any other PGs?
So good evening, sir.
Biggest gap.
This is Harish.
Hi, good evening. Yeah, hi.
Sir, I'm first year PG.
Yeah.
My topic is association of insulin resistance marker and severity of coronary artery disease using syntax score, sir.
Okay.
So my doubt also same as Madhivandana, sir. What kind of study group I can take, sir? Like study, what kind of study I can take, sir?
No, like in your case, like you're checking fasting insulin, homo IR, like anything like that, or is there anything different?
I'm checking lipid accumulation product and EGDR score. EGDR score, sir.
Okay.
Estimated glucose disposable rate score, sir.
Okay. So
So
in that case also, you it should be a prospective only, because prior that nobody must have not done right or documented. You have any data regarding that? Have you checked?
yes, sir. EGR score is more sensitive and it has decreasing value of EDGR has more severity rate in coronary angiogram, sir.
Okay.
So,
So see, whenever you got the thesis topic, go to PubMed, type those terms, that is called mesh, medical subject heading, that is your insulin resistance and the patient group. Search it. You will find many studies. So which is a recent one, you go download it and check it, how they have done. You will get an idea, right? And then prior to conclusion in the discussion, there will be limitations. What are the issues they have faced? You check that, and if possible, you can correct it in your thesis protocol, and then you can. So everything is online actually. You can check. Have you guys used PubMed? Any idea you use PubMed ever?
yes, yes, sir.
Please use PubMed. Keep searching. Like I know you you can search for practice guidelines also. It will be also available. So go to PubMed, search your thesis research topic. You will get n number of studies. From there, any review article that will be compiling the recent data. And second thing is any recent trial or recent study, if it is there, you check. Or if not, your study, when it get published, it will be the updated data, right?
Okay, sir.
Yeah.
Thank you, sir.
Thank you.
Sir, I just have this generalized doubt, sir. Like, for looking about this research article, sir, is it PubMed? Is there, sir? Like, what are the other sources, sir? Like, whenever we look for sources, no, there are multiple sources, sir. But which treatment is followed, we have a doubt, sir. For example, when even in any, for example, hypertension, also European Society guidelines, it says one guidelines, and we are not able to know what are the latest updates, sir. Which is going phase 3 trials, or which has been latestly
For that,
updated.
you
Yes.
need to check actually clinicaltrial.gov.in. So from that, there
Okay,
are
sir.
many subheadings will be there. Clinicaltrial.gov.
Okay, sir.
Okay. There you can find what like which disease you are going to check, what is the intervention, what is the population they are going to study. If you click
Okay.
search, it will show. Or
Okay.
if you want to know only phase 3, that also advanced search, you can uh, keep it. You can take
Okay,
out
sir.
phase 0, phase 1, phase 2, phase 3 only you can see. Then you will get to know which place the trial is going on. If it is completed, if you scroll down, you can check if it is published or any result is available, you can check.
Okay, sir. It's a clinical.
Clinicaltrial.gov.in.
Okay, sir. Okay, sir. Thank you, sir.
Yeah, thank you.
So any other PGs? Jasper, any questions?
Sir, no, sir.
So I have
Okay.
shared in our group, actually, you can click it, log in today itself, so that please read in your phase, finish it off within 6 months. Because you will be held up with all your clinical work, please. And my suggestion, please do some studies, observational or interventional in infectious disease. That is actually a burning topic now. Please do it. And sir's area of interest also infectious disease. So please do it, and you'll get good inputs from sir. So it will be first go for a conference which is exclusively ID related, then go to global conference to publish, right? And you will get grant for traveling also. They'll give you 2 lakhs till 2 lakhs. They'll give you travel registration and other procedures also. They'll give you money. So please use this.
Gap in our department is our PGs are very much fond of observational studies or epidemiological studies. They will never select this interventional studies. So I am crying for the past 1 to 2 years, literally. So I am begging every PGs to take up interventional studies, but they are not that much fond of.
Sir,
So
why
I
not
want your help.
other than thesis, they can do a separate research so that
That is why we have started this PG research conclave.
okay,
So
sir.
I have allotted topics for secondary PGs.
Okay,
First year
sir.
PGs will be doing dissertation.
Hmm.
Secondary PGs will do the short-term research project, and they have to publish it in any of the journal. So
Right.
that is a mandatory thing in our department.
Okay, sir.
So I want your help
Sure,
to
sir.
shift our students' attention from observational study
Guys, you
to
have a good
interventional studies.
approachable HOD. Please
Ah.
use it actually. You won't get, actually, I have come across many colleges and institute also. Your HOD is very much approachable. Please use him. Right. Uh, I'm not telling because I have come from that institute for 11 years ago, but still I am with there because like our subject, it holds us actually. Though I am a different subject, we have a collaborative approach. So that's what I'm telling you.
Okay, if you have no more questions, I request the registrar to conclude.
So thank you, Dr. Naveen. It was such a wonderful interactive casual discussion. So possibly, as Sir said, he has been doing a lot of pushing and pull-ups for making the PGs do research. So possibly your this interaction would make them more inspire them to take a further research and move forward.
Sure,
And
sir.
I will be all. I request you to help my PGs whenever they ask for doubts.
Definitely,
And
sir.
I think you will be disturbed more often from now today
I'm
onwards.
happy to help.
From our PGs, sir.
Happy to
And
help.
it is such a joy to look at our TV TKMC's alumni to having gone to a great position as a clinical pharmacologist.
Always indebted to TKMC, sir. Always there.
Definitely. We are always indebted to the institutes that we study.
Yes,
So
sir.
it was such a good interaction with you, Dr. Naveen.
Thank
And
you, sir.
hopefully we'll do much more research and get our institute to a bigger place. Thank you. Thank you,
Yes.
Nanda.
Thank you, sir.
If there is no more discussion, we can wind up the session. Thank you, Anandal. And we'll meet in the next webinar. It will be held in the next month. Thank you.
Thank you, sir.